Hi, good afternoon. I'm Janet Lucas-Taylor from Northwestern Mutual, and it is my distinct honor to introduce our keynote speaker this afternoon, Wendell Potter. This gentleman is so accomplished, I can't do this without his bio in my hands, so I don't miss anything. Wendell is an advocate for American health insurance payment reform, New York Times best-selling author, and a former health insurance industry's communication director. After really seeing firsthand how strategic PR and lobbying is used unfairly to tilt the scales towards corporate interests over the people's interests, he left his corporate career to advocate for meaningful change in healthcare reform. Wendell has testified before Congress, spoken at more than 200 public forums, and authored 2 books. He is currently the president of 2 not-for-profit organizations, the Business Leaders for Healthcare Transformation and the Centers for Health and Democracy, which convenes the Lower Out-of-Pocket Costs Now Coalition. He also publishes the newsletter Healthcare Uncovered, and for those of you who are not subscribers, I highly recommend it. It's fantastic. So please, will you join me in welcoming Wendell Potter. Thank you. Such a pleasure.
My pleasure. Thank you. I'd like for you all to do some dreaming with me this afternoon. We often hear that the United States of America not only is the richest country on the planet, but also the richest country in all of recorded history. We also hear that we have some of the best doctors and hospitals in the world, and many of them are, of course, right here in Wisconsin. So now let's dream. Let's imagine what our country would be like if 25 million of us were not uninsured. 60 million of us were not functionally uninsured because of high deductibles and other cost-sharing obligations. 100 million of us were not saddled with medical debt. And imagine that our doctors didn't have the highest suicide rate of any profession, that our neighbors were not dying of diseases of despair, and that we lived as long as folks do in Costa Rica and Cuba. We don't. And imagine that we lived in a country where we didn't have to spend $4.5 trillion on health care because about 30% of that is going to administrative functions and profits. Or just last year, speaking of profits, the 7 largest or the 7 for-profit health insurance companies took in $1.25 trillion in revenues and made $60 billion in profits, and these are the companies that comprise what is often referred to as BUCA, plus a couple more, Centeva and Molina, that are almost pure-play public insurance companies that play in Medicare and Medicare Advantage and Medicaid. And now imagine that not a single one of us would have to resort to getting care in barns and animal stalls. Now, I mentioned that last one because you might not know that getting care in animal stalls is a reality for many people in this country. I didn't know it either until I took a trip back home to Tennessee a few years ago to go see my folks. At the time, I was vice president and chief spokesman for Cigna, and looking back on that time, I think a more appropriate title for me would have been chief propagandist. This was in 2007. When a growing number of lawmakers in Washington were saying they were going to try once again to reform the U.S. healthcare system. This was 13 years after I had helped send the Clinton healthcare reform plan down in flames. I was already deep into strategic planning with my peers in the industry to kill whatever Washington came up with if we didn't like it. When I got to Kingsport, Tennessee, I noticed a story in the local newspaper about something called a healthcare expedition that was being held at the Virginia-Kentucky Fairground in Wise County, Virginia, which is about 50 miles north of where I grew up. The story said that people were going to be driving from hundreds of miles away to get care that was being provided free by doctors and dentists and nurses who were volunteering their time over a 3-day weekend in late July. According to the newspaper, this was the 9th year that an outfit called Remote Area Medical had held this pop-up clinic in the heart of the Southern Appalachians. But I'd never heard of it. I was intrigued because the paper said that a lot of those folks, as you can imagine, were uninsured. It just so happened that I was writing an industry white paper at that time to make lawmakers and the public try to get them to believe that the problem of the uninsured was not a big deal. I was able to try to make that argument by slicing and dicing data in certain ways. And I wrote that a lot of the nearly 50 million people who were uninsured at that time were that way by choice. They were just shirking their individual responsibility to buy health insurance. What I was leaving out, of course, was that insurers back then routinely refused to sell coverage to millions of Americans because of a pre-existing condition. We referred to those people as uninsurable, and we blackballed about 1 of every 3 people who applied for individual insurance back then. I decided to go check that scene out in Wise County. So I borrowed my dad's old car, and I drove up there. And folks, I've often said that U.S. Highway 23, which meanders through the mountains between Kingsport and Wise, was my road to Damascus. I was not the same person on the drive back home. When I got to the fairgrounds, the parking lot was jam-packed, and I had to park about half a mile away because there were so many cars there. And I noticed as I got close to the fairground gates that a lot of folks had spent the night in their cars because only a limited number of people could get in the fairground at any given day. A lot of them spent the night in their trucks. When I got to the fairground gates, I really couldn't tell what was going on until I walked inside. And when I did, it was as if I'd been hit with a lightning bolt. I saw people who were lined up by the hundreds. They were soaking wet because it was raining that day. But they were not about to lose their place in line. And I noticed that a lot of those lines led to barns and animal stalls. Volunteers, before this started, had tried to clean up those animal stalls as much as they could. This is the United States of America I'm talking about. I couldn't believe what I was seeing. And it shook me to the core. And I realized a few things at that time. I realized that I had to take some responsibility for it because as chief propagandist for a big company, my job was to make people believe things that really wasn't true, to obscure very important facts, and to try to achieve my top major job objective, which was to enhance shareholder value. I also realized that the job that I was doing, in many cases, was the exact opposite of what I tried to do in my first career. I wasn't an insurance executive all my life. I started out in the journalism business. I was a newspaper reporter in Tennessee, and then later in Washington. I covered Congress and the White House and the Supreme Court for Scripps Howard newspapers, which sadly is no longer. But I realized that day that during my career as a journalist, I always tried to be honest, straightforward, never to intentionally mislead people, never to leave out, never to obscure important facts. But I realized that's exactly what I was being paid to do, and paid quite well to do, to make lawmakers, the media, the public, again, to believe things that just simply was not true. And I realized, too, that if my parents, who were working class, hadn't scrimped and saved and put enough money in the bank, I probably would have been one of those folks, or could have been. But I was able to go to college and get a good job. But those folks in those long lines could have been people I was related to, people I could have grown up with. But I did make a commitment that day that I would have to find some other way to earn a living. But you know how things go. I went back to the office. I told some of my colleagues what I'd seen. And the next week, I was back flying on the corporate jet with the CEO from Philadelphia on that trip to Connecticut. I knew that the cost of jet fuel alone was about $5,000 for that little trip there. And I was paying more attention. I noticed that it was at lunchtime. We were served lunch by a Cigna employee who was our flight attendant, and we were served on gold-rimmed china, given gold-plated flatware to eat it with. We were sitting on leather seats. And I, for some reason, thought back to what I'd seen just the week before, people getting care in animal stalls. But it would take something else that would make me really walk away from my career. A few months later, one of the jobs of my staff and me was to handle what we referred to as high-profile cases in which people would complain and sometimes get the media's attention, sometimes lawmakers' attention, because they'd been denied something that their doctor said they needed. In this case, Natalie Sarkeesian, a 17-year-old girl in Los Angeles, needed a liver transplant. And the transplant was scheduled, and the family arrived at the hospital waiting for the surgery to begin. But instead, one of the surgeons took the family aside and said, "I'm sorry we can't go forward because Cigna has not given us clearance." And the family had no idea what the doctor was talking about. They knew that transplants were a covered benefit, but they were told that a Cigna medical director in Pittsburgh had reviewed the request for coverage and had decided, in his opinion, it wasn't medically necessary or medically appropriate for Natalie. Well, the family became a very squeaky wheel, which is what I advise anyone to do if you're in a similar situation. Do your best to raise a stink. They got the media involved in Los Angeles. They got the National Nurses Association involved. They got the Armenian community involved. And it became just a horrible few days for my staff and me because we were constantly fielding questions, calls from reporters there, but eventually all over the world. CNN was covering live a protest that the family had planned to stage in front of our headquarters, our Los Angeles headquarters, actually Glendale headquarters. And I had it on my TV. And I rushed to the CEO's office and said, "Look, this is what's going on." He quickly called the chief medical director and the president of Cigna Healthcare, and within a few minutes, a decision was made to reverse that denial. And part of my job was to try to figure out how to get the word to the family. And I did that. And I reached out to a lawyer I knew in the Glendale office. I could tell as I was watching TV that someone had whispered into Mrs. Sarkeesian's ear the good news that Cigna was going to cover the transplant. And I felt pretty good about myself. You can compartmentalize a lot, and I did that throughout my career. But I wish the story had a happy ending. 5 hours after Cigna agreed to cover the transplant, Natalie passed away because too much time had passed since the original request was made. She got sicker and just was no longer eligible for that transplant. That was it. I did not have it in me to continue in that job, doing that kind of work. So not long after that, I turned in my notice and I walked out. I was on May the 2nd of 2008, and my last responsibility was to handle the financial communications for the company's first quarter earnings, which was what I had done for many years. My name was in every one of Cigna's earnings releases for 10 years. And again, I also had a big role to play in working with my colleagues in the industry and putting together political and PR campaigns to try to kill any kind of reforms we didn't like. Over the next several months, I started reaching out to healthcare reform advocates in Washington who I knew would be pushing lawmakers to pass a big reform bill. And my idea was that I could work behind the scenes to tell them what I had been working on and what the industry was likely to do, what their talking points were going to be, because I'd helped write them. Eventually, though, when it seemed that lawmakers were beginning to lose their nerve, I was told that if I really wanted to make a difference, I should go public with my story, and frankly do it as a whistleblower, which is what I did, albeit with a whole lot of reluctance, because I knew that the links that my old industry goes or takes to discredit its critics. But on June the 24th of 2009, I took the plunge into a very deep and unscary unknown. I testified for the first time as a whistleblower before the Senate Commerce Committee. And this is how I introduced myself that day. My name is Wendell Potter, and for 20 years, I worked as a senior executive at health insurance companies, and I saw how they confuse their customers and dump the sick, all so they can satisfy their Wall Street investors. Well, my testimony attracted a lot of media attention. My first interview was with someone I admired for many years, Bill Moyers. After that, I did countless other interviews. Time Magazine, the Washington Post, the New York Times, and a lot of other outlets wrote about me. And I started getting calls from publishers wanting me to write a book, which I did, which Janet mentioned. It was called Deadly Spin. I've actually written 3 other books since then, and hundreds of op-eds that have appeared in media outlets around the world. And I've been extraordinarily blessed to be able to do this work, and frankly, lucky to still be standing here. My second book, by the way, is called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And that is at the heart of the reason why it is so hard to change our healthcare system. In many cases, it's the problem of money in politics. Well, I'm still at it. I lead 2 nonprofit organizations that are focused on healthcare reform, one of which is a business group, and also a coalition of about 70 businesses and organizations that are pushing to hopefully send high-deductible plans to the ash heap of history. And by the way, a lot of folks who go every year to a remote area medical clinic have insurance. They just can't use it because of their deductibles or co-payments or their co-insurance obligations. So they go stand in line and wait for care in barns. And now I also publish my own newsletter, Healthcare Uncovered. I do hope you will sign up for it. This morning we published a piece that I wrote while I was waiting to come over here at the Westin. Here's what I wrote. Some of you, I think you've told me you read this. We published it a few hours ago. I'm writing this in my hotel room in Milwaukee, where I'll be speaking to a gathering of local business and community leaders later today about what I think they might want to understand about big insurance. Actually, I scrapped my prepared remarks when I saw the shocking but completely credible investigative reporting by reporters at Stat News. It appeared yesterday. It was about United Healthcare's private Medicare business, which they market and other companies market as Medicare Advantage, and the company's use of AI to deny or severely restrict access to often life-saving care. And today, those reporters, Casey Ross and Bob Herman, are reporting that a class action lawsuit was filed late yesterday against United Healthcare. The lawsuit, which was filed in federal court in Minnesota on behalf of the families of 2 United Health Medicare Advantage enrollees who died, accuses the company of using an algorithm to systematically deny coverage to elderly patients needing rehab and skilled nursing care. Now, I plan to use their reporting, as I wrote here, during my speech, this is what I'm doing right now, to drive home my overarching point that big for-profit insurance companies will do whatever it takes to make Wall Street happy. And in their relentless pursuit of profits, they're putting Americans' lives and their bank accounts at risk. The headline of that stat story was, United Healthcare pushed employees to follow an algorithm to cut off Medicare patients' rehab care. The story, which was meticulously reported, rang very true from both my professional and my personal experience as a former health insurance company executive and as a son of a former United Healthcare Medicare Advantage enrollee. Had I not been able to switch my mother out of her MA plan and into traditional Medicare after she broke her hip, I believe she would have died years earlier. The stat story, along with another blockbuster story that appeared in the New York Times last October, a year ago in October, under the headline, "The Cash Monster Was Insatiable, How Insurers Exploited Medicare for Billions," should be required reading for every member of Congress and anyone who cares about how big insurance companies are sucking trillions of dollars out of employers' and taxpayers' pockets while sending many of our people to early graves. Now here's the first paragraph of that stat story. The nation's largest health insurance company pressured its medical staff to cut off payments for seriously ill patients in lockstep with a computer algorithms calculations, denying rehab care for older and disabled Americans as profits soared, a stat investigation has found. A bit further down the story, there's this. Internal documents show that United Healthcare, a United Healthcare subsidiary called NavaHealth, set a target for 2023 to keep rehab stays of patients in private Medicare plans within 1% of the days projected by the algorithm. Former employees said missing the target for patients under their watch meant exposing themselves to discipline, including possible termination, regardless of whether the additional days were justified under Medicare coverage rules. And then there is this. The stringent performance goals was part of a broader effort to reduce expensive nursing home care for frail patients with privatized Medicare plans, the internal documents show. The strategy was conceived and executed by former top Medicare officials whose policies became a blueprint for United Health to reap hundreds of millions of dollars annually by shredding the government's safety net with payment denials backed by an algorithm. The story quotes by name one former United Health employee who says she was fired for approving coverage for care she felt was justified, but that made her an outlier within her department. You can be certain that Stat's lawyers reviewed every word of this story and made sure that the reporter's findings would hold up to scrutiny. When I was a VP and department head at Cigna, I had to rank the employees under me based on how well they met their annual job objectives. If an employee fell below a line that HR and the C-suite had drawn, I'd have to fire them. There was no wiggle room. It was called forced ranking, and it's really gut-wrenching to have to carry that out. Every employee of the big for-profit health insurance company knows that they have to do their part to help the company achieve profitable growth and enhance shareholder value. You do not need to get a memo that explicitly states that. It is part of the corporate culture and way of doing things. You learn quickly that you are in competition with your coworkers, and you'll do whatever you can to keep from falling below that line. You do not want to be seen as not a team player and not engaged in your work. Reading those reporters' stories brought back the nightmare that my mother found herself in when she needed rehab and skilled nursing care. We learned there was a very short list of facilities in United's network in her area of Tennessee. After she was discharged from the hospital, she was transferred to one of United's in-network facilities, and it quickly became clear to me that Mom probably wouldn't live long if she stayed there. For one thing, the staff didn't seem to be making much of an effort to get her to be able to walk again. As a consequence, she was in bed much of the day and night and developed pressure sores that, as you all know, can lead to infections and are challenging to treat. They can and often are lethal. At one point, a nurse at the facility told me that I should begin getting Mom's affairs in order because the infections likely would kill her within weeks, if not days. Well, I did some quick research to see which facilities in the region had the best quality scores and arranged for Mom to be transferred to another skilled nursing facility about 30 miles away. The problem was that this new facility was not in United's network. So I had to help Mom switch back to traditional Medicare, which doesn't have proprietary and inadequate provider networks. Almost all doctors and facilities participate in traditional Medicare. The care team at the new facility went to work right away to address the pressure sores and to get Mom back on her feet. Mom would go on to live almost another 10 years. The stat story goes into great detail about how United Health uses algorithms to determine how long a patient can get coverage for a stay in a rehab facility. The patient stories are heartbreaking. They also show that appealing a denial is often fruitless. It's important to note that NavaHealth, which is owned by United Health, is also used by Humana, maybe other companies as well too. Humana, where I used to work, has the second highest number of private Medicare enrollees behind United Health. It's also important to note that UnitedHealth markets its private Medicare plans in a long-standing partnership with AARP. You can turn your TV on for a few minutes today, and you likely will see an AARP UnitedHealth ad. That's because we are in the midst of open enrollment, when seniors have a window of a few weeks to pick among traditional Medicare and a bewildering array of private Medicare plans. People don't really know what they're choosing in many cases. The ads never mention any of the many potentially deadly side effects of enrolling in a Medicare Advantage plan. As the Washington Post reported today, they report today about that class action lawsuit that I mentioned earlier. That suit alleges that UnitedHealth knew that the algorithm it was using had an extremely high error rate and that it denied patients' claims knowing just a fraction would file appeals to challenge the insurer's decisions. And I knew this too. Very few people take the time or even know that they have the right to appeal. It's an arduous process. If you're not well and you don't have someone to advocate for you, it's just not going to happen. The lawsuit notes that the family of one of the plaintiffs did appeal United's denials without success and had no choice but to pay up to $14,000 a month out of their own pockets in order to continue providing care for the elderly man's skilled nursing care. Now, that story was about Medicare Advantage. But I want you all to know that if big insurance companies are cheating taxpayers and the elderly and disabled out of life-saving care to boost profits, they're doing the same thing to people enrolled in their commercial plans. In fact, ProPublica a few months ago published an expose of how Cigna, where I used to work, built a system that allows its doctors to instantly reject a claim on medical grounds without opening the patient's file, leaving people with unexpected bills. The reporters found that over a period of 2 months last year, just 2 months, Cigna doctors denied over 300,000 requests for payments using this method, spending an average of 1.2 seconds on each case. Folks, I doubt that anything that I've said today really shocked you, because you all know that big insurance companies continue to confuse their customers and dump the sick, all so they can satisfy their Wall Street investors. In the years since I first said that, Cigna and United and the other big carriers have become massively bigger as they have moved aggressively not only into government programs like Medicare and Medicaid, but healthcare delivery and the PBM business. This is called vertical integration. Cigna now gets far, far more revenue from its PBM than it does from its health plans. CVS Aetna now gets more revenue from its PBM than it does from its Aetna health plans or its 10,000 stores. And they are all laser focused on getting more and more of our tax dollars because their commercial business, quite frankly, has stagnated. We say, you hear politicians talking all the time, that 150 million Americans get their coverage to the workplace, and that's true. You could have used that exact same number in 1990 because we've seen more and more people are not able, more and more employers are throwing in the towel. They can't offer coverage. Less than half of really small employers offer coverage anymore. They just can't afford it. So it's not a growing business for these guys. That's why they're going so heavily after government programs. What this tells you is that employer customers are not nearly as important to big insurers as they used to be and as they were when I was in the industry. They are essentially treating their employer customers now as stepchildren. Now, if there's a silver lining to these pretty dark clouds, it's that this provides an opportunity for all of you here today, in my opinion. You have, in many cases, I think most of you have come to understand that employees do not have to hop in bed anymore with these big companies. Many of you have proven that. But I didn't know that until recently. I've just fairly recently become aware of what you all have done and what you're doing. So I want to help this movement grow, if I can, by using my newsletter, my advocacy groups, to help tell your story and to help you scale this remarkable work that you're all doing. I'll end with this call to action. Let me know how I can be of service. Thank you. Thank you.